Hello everyone, welcome. We're now ready to begin today's webinar, Leadership in the 21st Century Healthcare Industry. I'm Virginia with Rutgers Executive and Professional Education, and I will be your host and moderator. Rutgers Executive and Professional Education is the proud sponsor of today's webinar, and we're very excited to include this topic into our webinar series. We encourage everybody to send us your questions. To do so, you will use the control panel, which is located on the upper right-hand corner. You will click the orange arrow to open your control. You will type in questions in the question box and send press at any time. We will respond to your questions at the end of the webinar during our question and answer session. This webinar is being recorded, and a link to the archive version will be sent to you by email by the end of this week. It's now my pleasure to introduce our instructor. Dr. Bill Castellano, Rutgers Professor and Associate Dean of Executive and Professional Education, has over 30 years of experience working in corporate Fortune 50, entrepreneurial, and research environments. Additionally, Bill's research, teaching, and consulting activities are focused on the effective management of human capital, employee engagement, and developing leaders for the challenges of the 21st century. Bill, please take it away.
Well, thank you, Virginia, and good afternoon to everybody who's participating. It's my pleasure to present some of the research we've been doing regarding leadership competencies for the healthcare industry in the 21st century. And I think one of the first things that I think we need to focus on is what's the context in which we need to develop leaders when it comes to some of the trends that are impacting the healthcare industry. We typically call this the new normal. These are structural trends that are fundamentally impacting work, how organizations compete, and the kinds of labor that we need to be successful. And the three, I think, most prominent trends that are impacting the healthcare industry, certainly the aging population, increasing demand for the services that healthcare providers are providing, responding to disruptive technology, how do we integrate technology into processes, fundamentally transforming work itself, and then of course these evolving regulations, particularly how organizations originally responded to the Affordable Care Act and now anticipating some of the changes that may be taking place with this new political environment that we're operating in. I think specifically what we've seen as far as responding to these trends, in which we'll go a little bit deeper, we've seen this focus on value-based purchasing, a need for more integrated delivery systems within hospitals, aligned strategies between human capital and business, and then of course these new talent and leadership challenges that healthcare providers are now experiencing. When it comes to value-based purchasing, I think this has been some of the more significant challenges. Organizations before the Affordable Care Act, primarily focused on clinical processes and efficiency, and there's now more of a balanced need to also think about quality, outcomes of care, and also capturing data on patient experiences and satisfaction. So this is fundamentally creating new performance measures that I think are a real driver of some of the changes that leaders need to face to be successful in this environment. We're also seeing this need for an integrated delivery system. So this is creating significant challenges looking at both horizontal and vertical integration. Traditionally, a lot of healthcare providers focused on ambulatory care and acute care. We're now seeing an expansion of that to include population health and more preventive care, as well as post-acute care, dealing with rehab services, visiting nurses, and the like. So again, this is creating the need for oftentimes more collaborative relationships, driving a lot of mergers and acquisitions, creating strategic partnerships, again, creating some significant leadership challenges for these organizations. When we think about aligned strategies, it's important to think about the context of the external as well as the internal environment. So externally, we're dealing with all of these organizational challenges, strategy, strategic partnerships. Clearly, we're talking about a change management, new performance metrics, having to effectively be integrated and respond to the needs of the community. And then, of course, continuously monitoring and responding to these environmental challenges. So organizationally, you can't really think about leadership alone. You need to think about all of the areas that leadership can impact, including the work environment, the kinds of competencies that we need to be successful, what kinds of attitudes and behaviors that we need to motivate to execute our plans. And in all of these areas, we're seeing some significant changes. So clearly on the work environment side, we're seeing organizational structural changes, job design changes. We're seeing a breaking down of silos. Organizations are becoming more collaborative, more cross-functional. And in response, there's a greater need for having more empowered employees to make decisions. And then simultaneously, because of the focus on quality and efficiency, we also need standardized and efficient processes. So significant challenges just in that one area. When it comes to what kinds of competencies that we need, how do we recruit people, select people, train people, looking further down within the organization, we need all employees to be focusing on a customer orientation and solutions, more of a team player, a need to have greater business acumen and understand analytics and metrics. From a management perspective, we're really looking at creating a management team to create a high-performance management system. And on the leadership side, we're looking for people who are more transformational. And then most importantly, how do we get people to create the environment, the attitudes? How do we motivate behaviors? That we do primarily through performance management and our compensation systems. And here we're looking at creating greater accountability and reliability for all employees, managers and leaders alike. Again, that need to balance quality, cost, and patient satisfaction. These have to be incorporated into these new performance metrics. And then a greater need for people to be more team-oriented, more collaborative. So when you think about the role that leaders and managers play in creating this type of human capital strategy, we've done a significant amount of research, having about a dozen or so focus groups with managers and leaders in an array of healthcare providers, talking about these trends, talking about these strategic needs. And these are the challenges that we've identified. And we feel that these challenges kind of transcend and go across a number of different organizations. A need for greater integration and collaboration, I think, is a huge leadership challenge. More transparency, information sharing. How do you have more empowering employees getting involved in more participatory decision making? Being more consistent when they are communicating policies across the organization. Having very clear expectations that are communicated effectively. Also, we're seeing continuously this need to foster more innovation and this willingness to take more risk. We're clearly in a change management environment, going through some significant transformations. So this focus on innovation, creating new processes, new ways of working is a big area that we focused on. And then, of course, being more strategic focused and, again, balancing more these quality, cost, satisfaction metrics. When you think about leadership, you also need to think about management, right? Because clearly managers are the talent pool that move into leadership positions. And to create good leaders, you need to also develop good managers. And here, the competencies that we've identified, much better communication. If you're going to be empowering people and talking about change, you need to be able to be effective in communicating using various different media. Again, at a manager level, how do you create more consistent, effective performance management practices that focus on accountability and reliability? Creating better incentives tied to these specific objectives. We see a greater need for effective conflict management, a need for more development as well, being able to articulate and create career paths for employees, more of a coach, more of a developmental need as opposed to purely performance evaluation. We saw a specific inquiry about how do we interview people with these new competencies. So there was a need, we've identified the ability to interview people to understand exactly what their competencies are, how they would fit into the organization, and then time management. You know, we're looking at balancing multiple objectives, dealing with multiple strategic initiatives. So not surprisingly, time management was a clear need in many of the meetings that we've had. So what we did is we looked at all of these competencies and we developed a competency model that we think organizations can use when they're developing managers and developing their leaders. At the fundamental level, you know, what we call professional development, things that we've talked about, conflict management, negotiation skills, influencing decision-making. These are the core competencies that we think all of your employees, particularly your supervisors and managers, would need. Various people would also need to increase their business acumen. I think all employees need a better understanding of these financial management criteria, getting involved in process improvement. How do you conduct effective meetings? And clearly there is a functional need for improved supply chain management. At the beginning management level, people who are first entering into the management ranks, we think focusing on understanding dynamics of performance management, you know, creating effective performance management systems and metrics. How do you manage talent? How do you ensure you're engaging particularly this multi-generational and diverse workforce, creating a more inclusive type environment? We feel are key competencies, you know, for managers operating in the environment that we've been describing. As people move into more senior management type roles, we think there's a greater need to develop collaboration competencies, emotional intelligence, relationship management, and team building. And then at the leadership level, you know, clearly we're seeing a need for leaders to fundamentally understand from a strategic perspective what's going on in this healthcare landscape, understanding the trends, how it's impacting business, what do we need to do proactively. And not surprisingly, this is turning into a need to have more effective strategic and succession planning programs. How do you develop that pipeline for people to move into leadership positions? Focusing on how do you now execute these new strategies that we've been talking about and effectively deal with the change that's taking place. This need to foster innovation and understanding their power and influence within the organization as well as outside of the organization. In response to this, we've developed a number of programs that you can model, that you could come to Rutgers for more information. These are the competencies that we've already incorporated into our healthcare leadership programs that really touch upon all of the competencies that we've identified in that competency model. We also think that there's an even greater need to develop the needed competencies for that next level of manager. We've created a certified healthcare manager program. It's a very in-depth program. It also has a series of qualifying exams. We're proud that this is a trademarked, nationally recognized credential that people would receive after coming through this program and participating in all of the sections. They'll also have the opportunity to earn up to 9 academic credits towards a master's degree. So very briefly, this program, I think even at the manager level, focuses on, again, what is going on in this healthcare landscape, talking about the new legislations, population health, consumerism, the need to integrate policies with technologies. Not surprisingly, there's an in-depth module series of modules on leadership and relationship management, understanding leadership styles, focusing on interprofessional collaboration, building a positive and motivating work environment, dealing with change management, fostering creativity, innovation. And then on the business acumen side, again, modules on supply chain management, human resource management, risk management, quality and reliability, financial decisions. So all three of these sections, we feel, touch upon the competencies that we think managers that are aspiring for leadership positions need to acquire. Collectively, the management programs and the leadership programs, we feel, are addressing a lot of these challenges that healthcare providers are experiencing in this very dynamic 21st century environment of ours. So I'm going to pass the baton over to Virginia, who will be looking at the questions that you may have regarding the research that we've been doing on this topic.
Thank you, Bill. Thank you for this very informative presentation. Okay, so just want to remind everybody that if you do have questions, please send them to us using the questions box. You'll type in your question and you will press send at any time. If we don't get to everyone's questions, I will certainly funnel them over to Bill, and I can send the response to you by email. Okay, Bill, so our first question is, what is the role of leadership in creating the right organizational culture?
Well, a lot of what we've been talking about, these competencies that leaders need for this 21st century environment, is what's needed to create the right kind of organizational culture. I mean, culture is impacted by organizational structure, moving to a more collaborative, cross-functional organization, is creating a very different culture as compared to a more hierarchical, silo-based culture. We think hiring and developing more transformational leaders, people who get employees involved with decision making, a greater focus on employee engagement. These things collectively, will create what I would call a high performance culture that's needed to succeed in this environment.
Okay, thank you. Our next question is, what do you think is the biggest obstacle for healthcare providers for responding to these trends?
Well, this is a significant, I think, change management initiative for most healthcare providers, moving to this new performance measurement system, focusing on quality, cost, patient satisfaction. All of the challenges that we've been talking about are all significant. In my conversations with a lot of leaders in the healthcare arena, I think one of the real challenges is also creating the right kinds of incentives. There are significant budget constraints, I think, within this industry, but there needs to be an investment in order for them to be successful, to be able to motivate people to move in the right direction, to achieve these new objectives. So I think creating not only the right performance management metrics, but also creating the right types of incentives. And clearly, financial is part of that, but it also could be empowering people, focusing more on engagement, providing people with more developmental opportunities as well.
Thank you, Bill. Okay, our next question is about the CHM program. And did you work directly with any healthcare or pharmaceutical companies to build the curriculum?
Yes. We've actually conducted, as I think I briefly mentioned, we had about 12 focus group sessions with a vast variety of people from the healthcare and pharmaceutical world, looking at these trends, looking at the challenges that both leaders and managers are facing. We also work very closely with the School of Health Professions, who have an additional competency in this area, to develop this curriculum that we feel can help organizations develop the right types of managers to help them succeed in this environment.
Okay, great, thank you. So this concludes the question and answer session. If we didn't get to your questions, again, I will be sending them to Bill, and I will email you the response. And if you think of anything in the meantime, if you have any additional questions, you do have my email address. please feel free to reach out to me and I can send your questions along to Bill as well. So we just want to thank everybody for coming to this webinar. Want to remind everybody that the presentation, Bill's presentation today was brought to you by Executive and Professional Education. We are the leading source of expertise of the world of work. We offer innovative training and development solutions. And we offer an array of programs in addition to healthcare management, also in human resource management, labor management, leadership and management development, and project management. Our website for more information is epe.rutgers.edu. And as a thank you for participating in our webinar today, we would like to offer you a 20% discount off of our Certified Healthcare Manager program that starts in February. You'll go to our website, epe.rutgers.edu, and you will use the registration code webinar 011017. So again, thank you for participating in our webinar. This does conclude the webinar. We will be sending a link to the archive recording. I will be sending that by the end of this week. We hope to see you in our future workshops. And again, our website is epe.rutgers.edu. Thank you.